Top foods to avoid after age 50 for a healthier lifestyle. Hello lovely viewers, and welcome back to our channel. Today we're delving into a crucial topic that's relevant for all of us, especially as we age. As we hit the age of 50 and beyond, our bodies undergoes various changes, and it becomes even more essential to pay attention to what we eat to maintain a healthy and fulfilling lifestyle. Many of us are striving to live our best lives as we age, and nutrition plays a pivotal role in this journey. In this video we're going to explore the foods that you should consider avoiding after reaching the age 50. We'll discuss why these choices can impact your health, and most importantly, what you can do to make better, healthier decisions. But before we dive into the list of foods to avoid, let's understand why our nutritional needs change as we get older. I've consulted with leading experts in the field, and they've provided invaluable insights on what we should keep in mind. As we age, our metabolism tends to slow down, and our bodies may become more sensitive to certain foods. This means that our dietary choices need to adapt to these changes to ensure our well-being. There you have it. We have a better understanding of why it's crucial to rethink our food choices post-50. Now, let's jump right into the foods you might want to limit or avoid in your daily diet. Throughout this video, we'll discuss the potential risks associated with consuming certain foods and provide alternative options for a healthier lifestyle. So stay tuned, because these tips could make all the difference in how you feel and thrive during this incredible phase of life. We'll not only talk about what to avoid, but also highlight some fantastic, delicious, and nutritious alternatives. These will help you make more informed choices for a well-rounded and satisfying diet. Remember, life after 50 is an opportunity to embrace wisdom, vitality, and wellness. So, if you're ready to take control of your health and make informed food choices for a brighter, healthier future, then stick around. Hit that like button, subscribe, and let's dive right in. But before we begin, keep in mind that everyone's dietary needs are unique. Always consult with a healthcare professional or a registered dietitian for personalized guidance. Now we can start discussing the specific foods to avoid, providing information and perhaps some visuals or graphics to support your points. Make sure to explain why each food is best avoided after the age of 50 and consider adding tips for healthier alternatives. So, without further ado, let's get started on our journey. Top foods to avoid after age 50 for a healthier lifestyle. 1. Sugary drinks. Sugary drinks, such as soda, fruit juices, and energy drinks, can have a range of disadvantages for individuals over the age of 50. Sugary drinks are high in empty calories and can lead to weight gain. As metabolism slows with age, excess calories from sugar can contribute to obesity and associated health issues. High sugar intake is linked to an increased risk of heart disease. Older individuals are more susceptible to heart-related issues, making this a significant concern. Sugary drinks can negatively impact bone health by reducing calcium absorption. This can lead to a higher risk of osteoporosis and fractures. High sugar consumption can lead to digestive problems, like irritable bowel syndrome and diverticulitis, which tend to be more prevalent in older age groups. Sugary drinks can promote inflammation in the body, which is associated with various age-related health conditions, including arthritis and autoimmune diseases. Sugar in drinks can lead to tooth decay and gum problems. Dental issues can be particularly problematic for older adults who may already have dental concerns. Overconsumption of sugary drinks can lead to non-alcoholic fatty liver disease, a condition that can progress to more severe liver issues over time. High sugar intake from sugary drinks is linked to an increased risk of type 2 diabetes, a condition that becomes more prevalent with age. Managing blood sugar becomes crucial in your 50s and beyond. High sugar intake has been associated with an increased risk of certain cancers, which become more prevalent with age. 2. Red meat. High protein intake from red meat can put extra strain on the kidneys, which can be a concern, as kidney function tends to decline with age. The purines in red meat can contribute to gout, a type of arthritis. Gout tends to affect older individuals more often. Diets high in red meat may lead to an acidic environment in the body, which can result in calcium leaching from bones, potentially increasing the risk of osteoporosis. High salt content in processed red meat can lead to high blood pressure, which can become more common and problematic as you age. Excess red meat consumption, without adequate exercise, and a balanced diet, can lead to sarcopenia, which is the age-related loss of muscle mass and strength. This can affect mobility and overall health. High levels of saturated fats in red meat can raise cholesterol, leading to plaque buildup in arteries. This in turn increases the risk of stroke, which is a critical concern in older age. Some studies suggest that high intake of red meat may be linked to cognitive decline and an increased risk of neurodegenerative diseases, such as Alzheimer's, in older individuals. Processed red meats, like sausages and bacon, often contain additives and preservatives linked to health risks. The high fat content in red meat can lead to the buildup of plaque in the arteries. Red meat consumption is associated with an increased risk of colorectal cancer, which becomes a greater concern as people age. 3. Caffeine. Caffeine can interfere with sleep patterns, leading to insomnia or disrupted sleep, which becomes more problematic as one ages. Caffeine is a diuretic, potentially leading to increased risk of dehydration in older adults. Older individuals may experience irregular heartbeats or palpitations with caffeine intake. Caffeine can exacerbate anxiety and nervousness, which can be more pronounced in older age. Aged individuals can become more dependent on caffeine to stay alert, which can lead to withdrawal symptoms. Excessive caffeine intake might affect cognitive functions, such as memory and concentration, which are already vulnerable with age. Gastroesophageal reflux disease. Caffeine can exacerbate GERD symptoms, which are more common in older adults. Excessive caffeine intake may increase urinary urgency and frequency, which could be problematic for those with bladder issues. Caffeine can interact with medications, potentially reducing their effectiveness or causing adverse reactions. Consuming caffeine can trigger heart arrhythmias, which can be concerning for older individuals with heart conditions. 4. Alcohol. Alcohol can exacerbate existing health conditions, and after age 50, the risk of chronic diseases like heart disease, diabetes, and liver problems increases. Consuming alcohol weakens the immune system, making older individuals more susceptible to infections and illnesses. Alcohol is a primary cause of liver damage, such as fatty liver and cirrhosis. Alcohol impairs balance and coordination, increasing the risk of falls, fractures, and other injuries, which can have more severe consequences for older individuals. Excessive drinking can lead to social isolation, as it may strain relationships with family and friends who are concerned about the individual's drinking habits. As you age, your metabolism slows down, and alcohol takes longer to leave your system, leading to increased intoxication and hangover effects. Alcohol can impair cognitive function and memory, which is already at risk as you age, potentially accelerating cognitive decline. Habitual alcohol consumption can lead to alcohol use disorder, a serious condition that can be challenging to manage in older age. Alcohol can irritate the digestive system and contribute to issues like gastritis and ulcers. It's essential for individuals over 50 to consume alcohol in moderation or consider abstaining altogether, as the risks associated with excessive alcohol use tend to be more pronounced in this age group. 5. High-fat dairy. High-fat dairy can aggravate conditions like irritable bowel syndrome and may lead to diarrhea, constipation, or cramping. Some studies suggest a link between high-fat dairy consumption and an increased risk of prostate cancer, which is more common in older men. High-fat diets have been associated with cognitive decline and an increased risk of neurodegenerative diseases like Alzheimer's. As people age, lactose intolerance can become more prevalent, causing digestive issues when consuming dairy products. High-fat dairy may be linked to skin issues, such as acne, which can be particularly bothersome for some older individuals. High-fat dairy can raise total cholesterol levels, which can be problematic for those with existing cholesterol issues. Excessive intake of saturated fats from high-fat dairy could potentially raise the risk of gastrointestinal cancers. Hormones present in dairy products can potentially disrupt the endocrine system, which may be more sensitive to hormonal changes as we age. Dairy allergies can develop or worsen with age, leading to allergic reactions that can range from mild discomfort to severe symptoms. High-quality, high-fat dairy products can be expensive, and managing a diet with these products may strain an older person's budget. It's advisable for anyone over the age of 50 to consult with a healthcare provider or nutritionist to determine the best dietary choices based on their specific health and nutritional needs. 6. Fried foods. Fried foods are typically high in calories and unhealthy fats, which can lead to weight gain, and maintaining a healthy weight becomes more critical with age. Obesity and unhealthy dietary choices can put added stress on joints, leading to arthritis and other joint-related problems which are more common as we age. Fried foods often lack essential nutrients, while providing excessive unhealthy fats, depriving older adults of the vitamins and minerals they need for good health. The high calorie content of fried foods can contribute to weight gain and obesity, which is associated with various health problems. Consuming fried foods can strain the liver, potentially leading to fatty liver disease. Fried foods can increase the risk of gallbladder problems, such as the formation of gallstones. These issues are more common in middle-aged and older individuals. Fried foods can contribute to premature aging of the skin and body, making it harder to maintain a youthful appearance and quality of life. It's essential for individuals over the age of 50 to be mindful of their dietary choices to promote overall health and well-being. Reducing the consumption of fried foods and incorporating a balanced, nutrient-rich diet can help mitigate these disadvantages and support healthy aging. 7. White bread and rice. White bread and rice are high in empty calories, providing little nutritional value. As we age, our nutritional needs become more critical, and these foods can contribute to malnutrition. White bread and rice have a high glycemic index, which means they cause rapid spikes in blood sugar levels. This can lead to insulin resistance and an increased risk of type 2 diabetes. Highly processed carbohydrates can contribute to dental issues, which become more prevalent in older adults. White bread and rice can promote inflammation in the body, which is a risk factor for various chronic diseases that become more prevalent with age. Refined carbohydrates can cause energy fluctuations, leading to midday crashes and lower energy levels, which can be particularly problematic for older adults. White bread and rice don't provide a feeling of fullness for long, which can lead to increased snacking and overeating. A diet high in refined grains can negatively affect gut health, potentially leading to conditions like irritable bowel syndrome. Many commercial white bread and rice products contain additives and preservatives that may not be suitable for long-term health. Metabolic syndrome, characterized by a combination of factors like high blood pressure, obesity, and insulin resistance, is more prevalent as people age. Consuming white bread and rice can exacerbate these risk factors. To mitigate these disadvantages, older individuals should consider incorporating whole grains, such as whole wheat bread and brown rice, into their diets. These options provide more fiber, nutrients, and stable energy, which can contribute to better health and well-being in the later stages of life. 8. Excessive sweets. Excessive consumption of sweets, after the age of 50, can have a range of detrimental effects on your health. High sugar intake can exacerbate joint pain and inflammation in conditions like osteoarthritis. An excessive sugar intake can weaken the immune system, making the body less capable of fighting off infections, which is especially problematic as one ages. Diabetes, often linked to excessive sugar intake, can lead to vision problems, such as diabetic retinopathy, which can be a serious concern in later years. Consistent high sugar intake can lead to insulin resistance, making it more challenging for your body to regulate blood sugar levels effectively. Sugar can lead to mood swings and mental health issues, which can have a significant impact on the emotional well-being of individuals over the age of 50. Sugar can disrupt hormonal balance, which can lead to various health issues, including those associated with menopause or andropause. Excessive sugar consumption can shorten your lifespan by increasing the risk of various chronic diseases and health complications. While enjoying sweets in moderation can be a part of a balanced diet, excessive consumption after the age of 50 can have serious health consequences. It's crucial to be mindful of the foods we consume as we age, especially after reaching 50. While there's no one-size-fits-all answer, avoiding excessive processed foods, sugary snacks, and high-sodium items can contribute to better health in the long run. There you have it, folks, the top foods to avoid after reaching that golden milestone of 50. Remember, it's never too late to make healthier choices and prioritize your well-being. Adding a balanced diet, rich in fruits, vegetables, lean proteins, and whole grains, can help maintain vitality and well-being as we embrace the later stages of life. Remember, before making any significant dietary changes or adding supplements, it's crucial to consult with a health care provider to ensure it's the right choice for you. Please subscribe to our channel and like the video if you found it helpful. Stay tuned for our next video. Thanks for watching.